You had those lymph nodes. I mean, where are they now, first of all?
They're gone. That happened, when I started cleaning up my diet. Like, they're gone, every single one of them.
It was autoimmunity, allergies, reaction to infection. Now, we have a case study. I'd love to have Rosanna pop in. Rosanna, welcome. So, Rosanna, you graduated from our program how long ago?
It's been exactly almost a year.
And she's a typical patient that joins our program because, Rosanna, you were dealing with lichen sclerosis, which is an autoimmune attack against skin, connective tissue. And what kind of symptoms were you having prior to joining the program?
Oh, I lived with years of excruciating pain, vaginal dryness. The skin down there, and this is probably TMI, but it looked like it was dead. I mean, dead. And it was very fragile. So, intimacy was very painful. And I also, my pelvic floor sometimes felt like it was falling like out of me. I feel like I didn't have any tone down there as
Right.
well.
And I think, well, as I recall, did you not have early menopause as well? Because that's a really common pattern.
Yes, I did. I had menopause around 38 is when,
My
well,
early menopause sisters, autoimmune
yeah,
sisters.
we have a lot of the same stories. I
What the
mean,
heck?
I know.
Because I think I remember, like, even though you graduated a year ago, I think you had brain fog. Did you have hair loss as well?
I did have hair loss as
Yeah,
well.
yeah, and then pain, like, severe pain. And then periods wise, since you had early menopause, no periods since the age of 38, right?
Yeah, I assume they put me on the pill after the birth of my second daughter because at 31, all of a sudden my periods were, 2 weeks long, heavy bleeding. And so they said, let's put you back on the pill. And I was on it nonstop until I was 37. So then I took myself off the pill because I just said, I want to know what my body's doing naturally. And then my period never came back. So that's
Oh,
only when they finally tested my hormones. And I said, this is not normal. I have, 3 older sisters, and none of my sisters have gone through menopause early.
autoimmune gene. That's the interesting thing is not every daughter is going to have autoimmunity show up the exact same way.
No, but they all have different things going on, diabetes and severe allergies, skin rashes, like
Check, check, check.
huge. Yes, it's all over. My mom had 6 children in 8 years, and
Mm,
she had lots of, she's
hormonal
bipolar.
shifts,
Yeah, she had bipolar depression, hypothyroidism,
which you
and
now know is autoimmune.
yes, diabetes.
Didn't you find out during the program you actually have autoimmune thyroid as well?
Yes. I well, I get it tested all the time, but I'm in the normal range.
Right.
I even asked, I asked a lot of questions. I think I'm one of those
I
patients who
love that you
asks so
do.
many questions. But, I said, my mother has hypothyroidism. I think it runs in the family. Are you sure my numbers are in the normal range? They're like, yeah, they're in the normal range.
Yeah.
So,
What did you learn in the program about your thyroid?
well, I've learned that I have very low, total T4 was very low, and my T3 was very low. And so, because of that, I knew that I had hypothyroidism.
Yeah.
Um,
And here's the thing. So they did test your hormones eventually when you had no periods. What did they tell you about those hormones?
they just told me levels were the levels of an 85-year-old. It was kind of like, it is so long past menopause, because I said, am I in perimenopause? They're like, oh no, you are so far beyond. And I said, okay, is like, that's not normal. But she acted like, oh well,
Oh,
so
well,
yeah.
she's like, your hormones be dead, your ovaries be dead. And you're like, what? I'm 38,
Right.
right? It is a big deal. That's not normal.
And
Okay.
Rosanna, I'm so curious to hear, you listed off your symptoms for us, and the list was long. You talked about trouble with intimacy, your skin was having issues, there was hair loss, there were so many problems. And hearing the symptoms is one thing. I want to hear about what was living with that like? What was life like having all of those symptoms? And I'm sure it was impacting your life.
Yeah, it was hard before, this program, I really didn't talk about it. I shared it with my sisters, and those closest to me, but I really didn't talk about it a lot. And, I'm very private about my life, my sex life. And so it's not something that I would even talk to other people about, like, is this normal? Or, so I was just kind of hiding from it. Most people didn't know that I was as sick as I was all these years because I look so healthy, and I take care of myself and I eat right.
Rosanna, I call autoimmune disease the invisible illness. It's the invisible cancer.
Oh, I know. And so when I tell everybody I went through this program to turn around, they're like, "What?" Like, yeah, I know. I have all these issues that, due to my imbalance of my hormones, and that was a huge, huge trigger, to some of the other things that I have, uveitis and glaucoma.
We're going to talk about this. So my question is, what did you learn about your hormones when you went through the program? You did your testing, you went through the modules, we troubleshoot your patterns. What did you figure out about your hormones that was new and different?
Well, I learned that I had estrogen dominance, and I learned that I had
Your regular MD's like, that don't exist, girl. What the heck is that? That's not real. It's like levitation or something.
Oh, I know. I brought my paper in to my gynecologist just recently because I need to retest my hormones. And I had her look at the graphs, and she said, well, for postmenopausal, that is where I would expect your estrogen and your progesterone to be. She goes, your testosterone I see is very high, so I'll retest that. And so that was the only thing I got her to retest. And my testosterone is like now in a great range. So it is, woo, it's gone down.
So she had PCOS, by the way. Not only did she have estrogen dominance, she had PCOS, both. And the thing is, this also dispels the theory. A lot of people are like, I'm in menopause, then my hormones don't matter. No, you can have menopause and still be estrogen dominant, still have PCOS, still have a autoimmune shit show because of it. And that's a perfect example of that. And your MD said, oh, those two are in the normal range, not looking at the relationship between the two. Because do you guys know that estrogen dominance is one of the biggest patterns that feeds autoimmune disease?
Yes.
I believe it. I know in parts of my own cycle, when my estrogen rises, I experience the most autoimmune symptoms.
Yes.
But once you discovered that you had these patterns, what were you able to do? And what were your results?
Within like the first week, my insomnia improved because I started working on my blood sugar balance. So that was huge, which of course we know that contributes to your hormones and causing it to go, wonky. Also, when I went through and had my food mapping and started clearing the water of all the things, I found out I had a leaky gut. I mean, I had so many foods that I was intolerant to, but I didn't even know. My gastrointestinal tract does not tell me that things are bothering me, but instead,
it's not the food.
Yeah, it's not the food, but like all the food was causing all of the other things that are all the mystery symptoms. And then, of course, the program taught you how to eat properly, to eat all those things, the cruciferous vegetables that help clear out the excess hormones in your system.
What I'm hearing is every single pillar, learning about how to supplement, how to eat, all of this had to do with it. I think mindset was huge for you as well.
Oh, yes. I mean, like a lot of people, there were so many people who were so sick in the program, and you're sitting on Zoom calls with them, and you're thinking like, there's, sorry, it makes me emotional when I think about them, but you think they are so sick, and I am functioning. I'm functioning, so I can live with this.
And then you see them get better.
Yeah. But it's like we're used to functioning, and it's because we're so used to being sick.
Yeah.
We're used to our symptoms. So I had to learn that I was definitely worthy of this program.
I saw you change week by week. It was like Rosanna, who trusted herself, had confidence in herself, and who put her own health in high worth. I saw her come out every week.
Yeah.
Do you feel that, Rosanna? Do you feel like a different person physically and perhaps emotionally as well?
Oh, absolutely. I mean, I learned in the program with the mindset work that I am a pleaser, and I worry about everybody else except myself. Um, yeah, so I just kind of ignored everything throughout the years. I mean, I went to the doctors and tried to take care of things when I needed to, but I didn't focus on it. And it took me to retire from teaching to focus on me. And I found this program, and it just like changed my life.
Because this is a year later, and people always think, oh, maybe it's just a fluke that they got better after 2 months. Like, where are you a year after you've done the program? How are your symptoms now, even compared to the end of the program?
Oh my gosh. Well, okay, my sleep is better. I'm not as anxious because I've got control. I mean, you've empowered me to take control of my health. One symptom that we didn't talk about, which was a huge one, was I had glands like these were all swollen. I had a big grape here. Like my lymph nodes were swollen. I mean, I'm not talking just for a little short period of time. I had an ENT watching these for years
Yeah.
because they were getting smaller
Watch.
and getting larger. Yeah,
What are we waiting for it to turn to cancer or something?
they did remove one because after watching it, one got really big, and he said we need to remove it and make sure it's not cancerous. I
But
have a lot
you
of
know now why you had those lymph nodes? I mean, where are they now, first of all?
they're gone. That happened, when I started cleaning up my diet. Like they're gone, every single one of them.
It was autoimmunity, allergies, reaction to infection. That's why they were big. And those are all turnaroundable. Those are
Right.
reversible causes. And meanwhile, we're just sitting here like, let's watch and wait and see if it's going to turn into cancer or not while you have this Goomba sticking out of your neck. And then the other thing was, what about your visual symptoms? I mean, you had uveitis and glaucoma. Was your ophthalmologist, are you even aware that there was an autoimmune link with them?
No, I started questioning it when I started looking at some of the other things. I connected when I got the lichen sclerosis, the time that I was stalking you. I started making all these connections, and I thought, wow, perhaps this glaucoma and uveitis is also related to my autoimmunity.
Bingo.
Right. And I asked that question because it happened when I was recovering from shingles.
Yep.
So when I had shingles, that's when like,
I had
bam,
shingles. What the heck?
I know. I had a massive flare, and that's when everything just kind of went
Do you
crazy.
guys see these patterns though, Rosanna? At
Yeah.
36, I had a shingles flare on my left hip the same time I went into early menopause.
Oh gosh, yeah.
Now, didn't your ophthalmologist say that the uveitis and the glaucoma was not autoimmune related, correct?
Right.
So
Yeah.
what has happened to them since?
The uveitis is gone. They check it. I have two different ophthalmologists, and the ophthalmologist that checks my uveitis, he's like, no inflammation, no inflammation, no inflammation. My ophthalmologist is really shocked how low my eye pressure is, my inner optic pressure. But he's like, we're still gonna watch this. I'm on 3 different drops, and I took one of my drops because I was having side effects from it, and I took myself off of them. And he's like, that didn't even affect your pressure. So then I asked him, is my glaucoma related to autoimmunity? If my inner optic pressure is low, and like I'm not having any issues with it, could it be?
Yes, yes, and hell yes.
What do you do? Because my ophthalmologist, I need him. So I'm afraid to just like go rogue and do my own thing with my eyes. I have used a lot of the knowledge that I've learned from you to question it.
But you've also learned the skill of actually learning to ask questions of your doctors, inviting the right doctors to collaborate with you and work with you. Like he said, oh, maybe you don't need it. Right. So
Right.
I think that's another skill set is when you're recognizing what the autoimmune symptoms are, what the hormone related symptoms are, and they're all starting to be in remission, and you actually have results, data, and pressure measurements, you can actually say to your doctor and say, hey, can I try going off this drop or can we do less of it? The right doctors will be like, yeah, because we have data to back it up. It's not, you're not levitating and guessing. Like you have data to back this up. Remember,
Right.
I tell people, hope is for breakfast. People are like, oh, this gives me so much hope. Okay, fine. But hope is for breakfast. We end the day with results and outcomes, objective data that there's improvement and outcomes, which is what happened here.
I'm fascinated by this. And Dr. Maggie, maybe you can speak to this because you don't really hear about people turning around glaucoma, people turning around uveitis.
We do.
Yeah, right, you do. Rosanna did it. But in general, you don't see that happen, right? This is unusual for people who aren't addressing the pillars in the way that you're addressing them.
Right.
I think it's just crazy to me. Like, this is why the hormone checklist, all right? You guys want to learn more about what symptoms are actually hormone related at any age? Put hormone checklist in the chat right now and check your messages. Let's get you to recognize so many links of hormones to many of these symptoms, right? It's not just your hot flashes and insomnia. Her glaucoma and the pressure inside her eye. Did you guys know that's hormonally related too? And I'll tell you, none of her hormone, does she even have hormone doctors? None of her hormone doctors even know that. And her ophthalmologist doesn't even know that. But hormone imbalances will cause worsening of the lubrication in your eye, will cause changes in also the health of your optic nerve, will also change the pressure in glaucoma as well. And I see it all the time.
Yeah, my pressure fluctuates, and I can feel that some days may be weirder than other days, especially when I was teaching full time. I always had issues with my pressures. But now I just feel so good. I mean, it makes sense. Your eye, it's got a mucosal layer like everything else. And
Bingo.
I've got issues with other mucosal layers.
God, you're so smart. Winner, chicken dinner. Because here's the thing. Like, think about this. Okay, let's blow your mind some more. Whoever's listening. Lichen sclerosis, people think, oh, it's just skin in the vagina. What is skin? It's a connective tissue.
Mm-hmm.
It's just another what we call mixed connective tissue disorder. And where do we have connective tissue? All over our body, including the lens of your eye, right?
Yeah.
There's connective tissue everywhere. Connective tissue in your scalp, in your hair, in your blood vessels with blood pressure even. So people with cardiovascular disease, we have Heidi who had a heart attack and the cardiac numbers through the roof. Once you balance her hormones and pull back her autoimmunity, all her autoimmune symptoms and her heart numbers all started to go down. This isn't a cardiovascular program, but how did it improve? Because there's a link here. Connective tissue connects skin, bone, cartilage, but also things like artery walls, right? And lenses of your eye. So there's a connection here with all of that. I never look at Rosanna or anyone else that comes in. They're like, oh, I have lichen sclerosis. Oh, it's a vaginal hormone problem. Let's just fix that. You're done. No. What about the rest of all these? They're all linked. And when people come in and say, if only my vaginal dryness could get better, I'd be thrilled. I'm like, you're thinking too small.
There's a lot that can be accomplished.
Because they're all connected, right?
And Rosanna, it sounds to me like your life has totally changed over the last year. I'm curious to hear, I'm sure you probably can't even quantify it, but what is life like now compared to a year prior?
Oh, it's amazing. I mean, I feel so good. I feel so blessed that I've been able to go through this program, and I'm there. I'm more present with my husband, more present to my daughters. I've shared with Dr. Maggie that my daughter, you know, when she was a teenager, had all of those same patterns. She's PCOS and she suffers from depression, and she has been diagnosed with antiphospholipid syndrome, and they think she has lupus. And so it's like, to be able to be here and to help her is that's priceless. I did it not only for myself, I did it for my daughters. And now I'm recognizing things in my siblings. And so I'm always giving them a lecture about what I've learned. I always, not lecture, I guess that's not the word I should use. I'm always sharing my knowledge with them because I care about all of them. So yeah.
Love that.
It's changed your life and it's changed those around you. It's changed your relationships. It's changed, basically, it sounds like every aspect of what you deal with day to day and the things that are important to you.
Yes, absolutely.
And Rosanna's a typical case.
Yeah.
Like, this is a typical story. And it's so funny. I do believe how many of our symptoms actually overlap. Remember in the program, how many people with all different diagnoses, and you're like, you had that too? I had that too. I had that too. Like, it's crazy.
That's what makes the program so rich, is that you can sit here and you can listen to everybody, you know, talk about all their results.
Yeah.
And like, wow, okay. And you learn so much, and not just only for yourself, but like as I'm recognizing all of these things in all of my siblings and my daughters as well. So it's just an educational program that is really priceless. It's hard to explain how valuable it has been for me to go through this.
Thank you so much for sharing your journey with us and your symptoms and your turnaround. I think it's probably been very inspiring for people out there that can relate to a lot of the things that you went through.
Thanks for joining us, Rosanna.
Thank you. It was so good to see you guys.
If you know someone who can benefit from hearing this conversation, type their name in the comment section right now.
Let us know, what are the symptoms hormonally that you're dealing with? Even if you don't necessarily know that they're hormone related, what symptoms are you dealing with? Put it in the chat, let the team know so that you can get some resources and some help.
Thank you, everybody, for joining us. Have a wonderful night.